Well, good evening. I'm Dr. Mary Chapman, Chairman of the Des Moines Branch NAACP Women in NAACP Committee. I want to welcome you to the Women in NAACP four-part education series on recruitment and retention of foster parents. A special welcome to those of you who are joining us for the first time, and shout out to our returning champions of children and families. The topic this evening is how to advocate for your child in the school setting if a learning disability is suspected. I want to thank co-chairs of this event, Dr. Susan Prattis and Janice Lane Schroeder, for their untiring efforts in arranging our speakers for this kinship series. Women in NAACP is a standing committee in the national organization of NAACP for the purpose of enhancing the leadership role of women and serve as an advocacy vehicle to address the social, economic, political, educational, health, and welfare issues affecting women, as well as advocate for the emotional, mental, physical, and spiritual development of children. The WIN committee meets every third Monday at 6 p.m. The next meeting is Monday, April 17, followed by the last presentation in this four-part series at 6:30 p.m. Please plan to join us again next month. Watch for the announcement. Now I introduce Dr. Susan Prattis, who will introduce our speaker for the evening, followed by Janice Lane Schroeder, who will moderate the Q&A and bring closing remarks. But before Dr. Prattis presents our speaker, I want to remind you to put your name and email in the chat if you didn't note in your registration that you would like CEU or foster parent training credit. Also, if you have a question for our speaker this evening, also put that in the chat. Also, everyone will be on mute except the speaker. Dr. Prattis, the screen is yours.
Thank you, Dr. Chapman, and thank you for that warm introduction to our guests this evening and to Dr. Goins-Fernandez. We're very pleased to have her with us. This is going to be part 3 of the webinar series, and our title is How to Advocate for Your Child in School Setting if a Learning Disability is Suspected. And just to give you a bit of background for Dr. Joyce Goins-Fernandez, she is currently a clinical assistant professor and the vice chair for diversity, equity, and inclusion at the University of Iowa, Stedman Family Children's Hospital in Iowa City, Iowa. And her focus is attention and learning disorders, and she works within the Attention and Learning Disorders Clinic that's based in pediatric psychology, and that is a part of the Division of Developmental and Behavioral Pediatrics. She conducts ADHD and learning disorder evaluations with children and adolescents, and she also has space in her schedule to perform direct therapy with children and has a teaching practice with small group exercises and work with medical students who are interested in these areas. She has very strong background in this area. She earned her Bachelor's of Science in Psychology from Xavier University, which is in Louisiana. She completed a pre-doctoral internship at Butler University, which is in Indianapolis. Also completed her doctorate in counseling psychology at the University of Iowa. And her focus and interest lay in the intersection of social justice and examining issues that involve diversity, equity, and inclusion. And as the co-chair of this section of the Iowa Psychological Association, she's able to effectuate change and bring her strong background into areas that can help us on a statewide basis to see some of these issues more clearly. She has been the chair of this committee for the Department of Pediatrics at the University of Iowa for the past 5 years, and she's also the president of the Black Faculty Council within the Carver College of Medicine. And so for this third session, we want to make this a very relaxed sort of presentation so that everybody will feel free to ask questions, to query and gain additional information. We're doing this for both our current foster parents and for those who are considering becoming foster parents. And we're hoping that this environment is going to be very helpful for you to think about ways in which that will impact the growth and development of African American children who are in the foster system and in your families, and other children who also will benefit from this. So what we're going to do is cover the following topics. We're going to talk about what a learning disability is. We're going to talk about what you can do if you're thinking that your child may have a learning disability. You're going to learn a bit about what happens in a psychoeducational evaluation. And then, as you know, there are several different types of evaluation plans and programs that are produced as a part of the process of defining learning disabilities in children. And so we're going to discuss what actually goes into the written evaluation report that the school uses, and then discuss the differences between a 504 plan and an individualized education program. And then finally, because it is important for us to have 360-degree vision to have a sense of when things may not be going as well as we would like them to have, we're going to talk a little bit about some of the warning signs that might occur when the team that's charged with carrying out the individual education program is not doing what they should be doing, or what may need some assistance in being redirected. And so, Dr. Goins-Fernandez, I give you the floor. Thank you for coming to see us today.
Okay, am I unmuted? I think so.
You're unmuted.
Okay, awesome. Thank you for that wonderful introduction. So before I get started, can I just see a show of hands? How many people are familiar with the terms 504 plan or an IEP or individualized education program? You can use your actual hand, or you can do it with the reactions at the bottom. See 2 thumbs up, anyone? 3? Okay, 4. Okay, so some of this information will be brand new to you. So this is a very informal presentation. I do have a number of slides, but I like interacting with participants. So every now and then I may throw out a question, and you can either put a response in the chat or just yell it out through your microphone. So I'm going to attempt to share my screen now. Okay. So as Dr. Prattis mentioned, today I'm going to talk about advocating for your child in the school if you suspect that they have a learning disability. So I'm a trained psychologist, and my newer role is Vice Chair, Diversity, Equity, and Inclusion. I was just given that role last year for the Steve Family Department of Pediatrics. Okay, so I like to include this slide just so the audience can learn just a little bit more about me and just who you're interacting with this evening. So as I mentioned, I'm a psychologist, and Dr. Prattis mentioned that my main focus is doing learning disorder evaluations. I have a small handful of therapy patients that I work with. Currently, and I guess sadly, I think I am the only licensed Black psychologist in the entire hospital. So when I first started this job, it was strictly evaluations, but I didn't want to close myself off to any children who needed therapy and wanted to work with someone that they identified with. So I included that into my practice. I'm also a wife, so I'm married to, this is my husband, Jose Fernandez, and he's an immigrant. He's originally from Mexico City. So issues of immigration are also very important to me as well. Dr. Prattis mentioned that I'm really involved in DEI work and social justice. So at the top right corner, you'll see that I'm holding a book. I'm involved in a lot of service projects. So at the hospital, I ran a DEI book drive back in 2020, and we raised funds to purchase books that taught children about racism and discrimination, and we placed them in the 3 libraries around the hospital. And then lastly, I have advocacy. This is a picture of me on Capitol Hill back in 2020, right prior to the outbreak of the pandemic. And we were talking with Iowa legislators for mental health parity. So this is just a little bit about me. Okay. Okay. So Dr. Press already went through the outline, so I will skip that slide. So what are learning disabilities? And I know that this is a very busy slide, but there are three main learning disabilities: reading disorder, math disorder, writing disorder, to put it very plainly. So if a person has a reading disorder, they often have difficulties with accurate reading. Is very slow and laborious reading for them. And sometimes they have difficulty understanding what is read, and this deals more with comprehension. So in a private practice setting, they may call it specific learning disability with impairment in reading. Since I work in a medical setting, we call it dyslexia, but it's the same thing. Now, if there is problems with comprehension, I will write dyslexia with difficulties with reading comprehension. Sometimes there's difficulties with spelling, which is a part of dyslexia often, but it also can be part of a writing disorder. And there's specifiers for that as well. So spelling accuracy, grammar accuracy, and difficulties with expository writing, which they say clarity and organization of written expression. But in the medical setting, we call this dysgraphia. That's just a fancy word for writing disorder. And then finally, math. If a person has difficulty with number sense or just basic computation, and then if there's some kind of difficulties with math reasoning, and that just means applied math. So there's computation, and then like when you have to do word problems. So dyscalculia is just a fancy way to say math disorder. And if there's problems with applied math, you'll say with difficulties in mathematical reasoning. So those are the main learning disorders: reading, writing, and math. ADHD is also a learning disorder, but that's not the focus of tonight's conversation. Okay. So according to the DSM-5, which is the Diagnostic Statistical Manual for all of these disorders, academic skills must be substantially below expectation for a child's age and causes significant interference with academics or activities of daily living. Difficulties begin during school age years and may not manifest till later. So a lot of times I see children who are around 8 years old or in third grade, because that's when problems start coming out for children. Between kindergarten and second grade, a lot of things are really concrete. And then when you get to third grade, it becomes more abstract, and that's when persons with learning disabilities start struggling more in school. But I do see younger students as well. And so these difficulties are not better accounted for by intellectual disability. So that's a newer term. In the past, they would call it mental retardation, but now they call it ID, or intellectual disability. So a person cannot have a specific learning disability like dyslexia and have an intellectual disability. Is one or the other. So if a person has an intellectual disability, it means they have an IQ lower than 70. And it's more of a global weakness where they're low in all areas is the main thing. Okay, I'm going to keep going, but if you have questions about anything I just mentioned, please just put it in the chat. I have someone monitoring the chat for me. Okay, so next, how do I know if my child has a learning disorder or a learning disability? So many times the school will alert a parent to this. They often do standardized tests called the FAST, which stands for the Formative Assessment System for Teachers. And there's a FAST for reading, there's one for writing. And there's one that assesses a child's oral reading or oral fluency. And if a student is not a fluent reader, that is a sign that something more is going on. So I had a parent once tell me, oh, the school, they only care about how fast a student can read. And it doesn't matter if a student can read fast or not. And that's not what they're assessing. So slow, or if someone is reading is choppy, that's a sign that there may be a reading disorder. So for example, if I show you a parent, the words BAG, automatically you see the word and you're like, oh, bag. Now, if the student has dyslexia, it's not automatic, and they need to think about each individual letter and what it means. So if it's a B, the first thing a student with dyslexia might think is, oh, is that a B or a D? And then they might say, oh, okay, it's a B. And then their next thought might be, okay, what sound is associated with B? Ba. And then they go on to the next phoneme. And if you can imagine, if you have to do that for every word, it's going to take you longer to read. So yes, how fluent a student's reading is can be a sign if they have dyslexia or not. Okay. They also have another one. So in addition to the oral reading one, they have one that looks at concepts of print, letter sounds, names, phonological awareness, blending and segmenting words, decoding sight words, and sentence reading. So sometimes parents will come in and they'll say, my student is not meeting benchmarks on the FAST. And many times I like to collect that information because that's another good indicator that something else is going on. Have some of you heard of, you can do your virtual hand, and have some of you heard of the FAST? Like, do you have younger foster children where they may have taken these assessments in school before? Okay, it's usually something that they give to all students. Okay, we'll keep going. Okay, another thing a school might do is called response to intervention. So I'm not sure. Oh, I do see a hand. Okay, Harrison. And this is a 3-tiered approach. So the aim is to identify students who are struggling and give them the support they need to thrive in school. Okay, so they want to give a direct intervention, a targeted intervention, and it's a way to measure progress and provide support. So if a student is identified as high risk at school and they say, okay, we're going to give you a targeted intervention and monitor your progress. And if the student is not making progress even after directed intervention, then the teacher may say to you at a conference, your student is, or your child, not making progress, and we're concerned that there might be a learning disability here. Another thing you can do, sometimes parents, the school is telling them that their child is doing fine. So sometimes I have parents say, I know something is going on with my child, but the school keeps telling me that everything's fine, but he can't read or something like that. So then that's where I come in and they'll request an outside evaluation. So there's 2 different ways that I get referrals. One is from doctors or the child's pediatrician. The parent will tell the pediatrician, Billy is having trouble reading or writing, and they'll send us a referral through the doctor. We also get self-referral. So if you want to call or go onto our website and fill out the forms, you can do a self-referral as well. Okay. So here are some common reasons for referral. So there's unexpected underperformance in academics. So the child is performing behind same age peers. You'll see increased frustration with school or school avoidance. The child may try to avoid reading at all costs. Sometimes this can lead to lower self-concept. You may see increased behavior concerns if a person is struggling in school. And it's really important to tease those out. It's really careful not to label kids as behavior problems when they just might have a learning disability and this is how it's manifesting. They don't know what to do. So sometimes they might act out. Sometimes there's difficulties focusing or paying attention or increased hyperactivity that hinders functioning, and that's more the ADHD. So these are the main reasons. Okay, So once you call the clinic or we get the referral, we will send you a packet to fill out that includes some rating skills. So we want to get as much information as we can. So some of these will be behavior rating skills that also looks at anxiety and mood. We have a rating scale that looks at a person's executive functioning. We may request some handwriting samples, and we definitely want to know if you have access to their standardized test scores like the ISAFs, which used to be referred to as the Iowa assessments, or the FAST. So it's very important to collect collateral information as well. Okay, so what is assessed? I'll give this a minute. So it's depending on what the referral question is what I will evaluate for. But since this presentation is focused on learning disorders, I'll focus on that. So every child that comes to my clinic, we always start with a cognitive assessment, which is also known as an IQ test. So I'm not sure how many of you are familiar with IQ tests, but I'll go into detail about what an IQ test assesses shortly. Sometimes parents will say, oh, I don't understand because, we'll be reading together and I'll tell them a word and then the child will see the word 3 sentences later and they don't remember the word. And so I'll assess phonological memory, things like that. Okay. So, and then after the IQ assessment is when we go into academics and assess reading, math, and writing. Okay. So what is a psychoeducational evaluation? So like I mentioned, it starts with an IQ test. There are different ones. The Wechsler's tests are the gold standard, which is what we use at the hospital. And depending on what age the child is, I start evaluations at the age of 4. So I'll use the WIPC with 4 to 5-year-olds. And then I'll use the WIS for 6 to 16. And then the WACE is the adult intelligence scale for students over 16. And basically an IQ test looks at how a student thinks and learns because everybody learns differently. An IQ test will give us information about how your child learns best. So it'll tell us what their strengths and weaknesses are. So for example, someone might have strong verbal reasoning skills, but poor working memory. So by having this information, we can give recommendations to school on how to accommodate any weaknesses. The mean score is 100, the standard deviation is 15. So most of the time, we expect most children to be here within the average range. But every now and then, like I mentioned before, we'll see some kids with lower IQs who may meet criteria for intellectual disability. And this is when their cognitive skills are below 70 and they have adaptive functioning concerns. Okay. So an IQ test looks at 5 areas. So verbal reasoning, like vocabulary, judgment and decision-making, visual spatial skills, fluid reasoning. So like, for an example, one of the visual spatial tasks is blocks. I will show them a picture of a block design and they will assemble the blocks to look like that picture. So that's what we mean by visual spatial. And they also have to complete a mental puzzle. Fluid reasoning just looks at a student's ability to form patterns and relationships. And let's also look at their deductive reasoning skills. So like if-then relationships. Working memory is a student's short-term memory, but not only are we looking at can a student hold information in memory for a short period of time, can they perform a mental manipulation on it and get that information back to the teacher? And then lastly is processing speed. Looking at not only how fast a student can do something, but how accurate they are when they do it. So these are the components of an IQ test. Okay, so after the IQ test, we'll take like a 15-20 minute break. And then when the student comes back, this is when I do the achievement testing. So if they're concerned for dyslexia, I'll do the mini reading test. So like we'll look at their ability to recite words, which is word decoding, look at phonemic awareness or phonological processing, look at their oral reading fluency, we'll look at reading comprehension. So we don't just give one test, we give numerous tests when we're evaluating for a learning disability. We also do a special auditory task of phonological processing called the CTOP as well. When we're looking at math, we're looking at computation, math reasoning. And when we're looking at written expression, we're looking at spelling, their knowledge of writing mechanics. So like, do they understand how to write a basic sentence and use grammar properly and semantics? And then sometimes there's concerns about oral language as well. So I thought it might be nice just to go through a case. So this is all of this information is made up. It's just things I hear from parents when they come in. So this is the case of Hunter. Hunter is 8 years old. He's in the 3rd grade, and the parents are reporting that Hunter is having difficulty reading. They say things like he continues to reverse letters and numbers. And it's by 8 years old, it's not age appropriate for a student to continue to reverse B's and D's. That's something you might see in like kindergarten and 1st grade. They say he's a slow reader, has difficulties with spelling, avoids reading, but they say that he does pretty well in math. So that's Hunter. So this is his IQ scores. So his overall, now remember the average scores is 100. So for Hunter, his verbal skills are average, 108. Visual spatial skills are 97. Fluid reasoning is 100. Working memory is 93 and processing speed is 92. So all of these scores are in the average range. Now, when we look at his achievement performance, well, I'm going to ask you, what are some things that stand out about his achievement scores? You can just yell it out.
Oral, it's the lowest score.
So specifically, what else do you see?
Math scores are higher than his reading scores.
Mm-hmm. Yeah. So in general, like Mom said, Hunter is doing well in math. So remember, also the achievement test, 100 is also average. So he's within the average range. When you look at writing, his knowledge of writing mechanics is average. Spelling is lower. And it's actually consistent with his pseudo-word decoding, which is his phonological awareness. So if you think about it, if you're having problems with phonics, most likely you're going to have problems with spelling. Many times kids are, oh God, I remember finding issues. I think it's like phonetic spellers where they spell the word like it sounds. So for example, camped, they'll say C-A-M-P-T instead of C-A-M-P-E-D. And his essay score was a 96. Now the essay composition does not take into account spelling. It's just, can you write an essay? So his reading skills are noticeably lower than his other scores. And these scores are also lower than his IQ scores. So these are the total scores. So it's basic reading is 77, which is at the 6th percentile. Math is at the 30th percentile, which is average. And the written expression is at the very lower end of the average range. Okay, so when I take into all of the information that the parents told me how he performed, given he has average IQ, so we know that Hunter can learn, is capable of learning. However, his IQ is discrepant from his achievement. So the reason we do an IQ test first, if a child has average cognitive skills, we would expect reading, math, and writing to all be in the average range. And if it's not, then it's indicative that there's a learning disorder. And in his case, and I also did that specialized test of auditory processing. So elision, that just means segmenting words. So for example, one of the items is say cup, and the child says cup. And then I'll say, now say cup, don't say cuh, and the child should say up. So that's segmenting words. Then blending words is just as it sounds. I play a CD and there's a voice on it that says each individual phoneme, and then the child puts together each sound to say and makes sense the word. phoneme isolation. So I might say, see an example here. I'll say, what is the first sound in the word fan? And they should say fa. Or what is the last sound in mop? They should say pa, but a lot of times they'll say op, so they have difficulty isolating phonemes. And a phoneme is the basic sound structure in a word. So going back to the word bag has 3 phonemes, ba, ag. So that's what we mean by that. We also do a rapid naming task. So I will show them like letters in rows, and they'll have to just quickly tell me the name of the letter as fast as they can. Once again, we're trying to see if their simple recognition is automatic or if it isn't. And sometimes children who have dyslexia, they have a slower time recognizing symbols, and including numbers, and not just letters, but numbers as well. So Hunter's overall auditory phonological processing was below average, and his rapid naming total was also below average. So when I take all this information together, I do diagnose Hunter with dyslexia. So after the evaluation, it's time for me to write the report. My reports average 10 pages. We do a lot of testing. So I like to write a comprehensive evaluation that includes background information. So the day starts with me interviewing the parents, because it's a diagnostic interview, but the parent interview. So I include the information given from the parent on the presenting concern. I'll list the tests that are given. I'll tell you the results of those tests. And in the back, I actually include the test scores. A lot of times the schools want to see the test scores. And then I offer my interpretation. And I don't go into a lot in this, but there are cultural considerations that go into testing as well. And at the very bottom of the evaluation report, I offer treatment recommendations for at home and at school. Most of them are for at school. Okay. So usually I will recommend an IEP, and I'm going to talk about what an IEP is later, but it stands for Individualized Education Program. It's when a student gets special education services. So if I give a diagnosis of dyslexia, I'm going to recommend that the child be considered for an IEP, which means that he's going to be given that pull-out service where he will physically leave the classroom to go into another classroom to get a direct reading intervention from the special education teacher. The most important recommendation is a phonics-based reading intervention. I often recommend Orton-Gillingham method, which is somewhat expensive, I heard from parents, but it has proven results. Barton program is another good one, and I know in the Iowa City area, they use Wilson's reading, as long as it's a phonics-based approach. So if your child has dyslexia, it's your right to ask the school, what type of reading intervention are you giving them? Is it phonics based? You want to make sure you do ask. I'm also going to recommend extra time for reading. And if the parent has the resources, they may be able to afford a private reading tutor, depending on how severe the dyslexia is. Okay. So now quickly, I'm going to talk about the differences between what a 504 plan is and what an IEP. And in short, a 504 plan is when a student receives accommodations within the classroom setting. They are not receiving pull-out services. So for example, if I diagnose a child with ADHD, I recommend a lot of behavioral accommodations that can take place in a classroom. So this could be anything like preferred seating closer to the teacher, or testing in a reduced distraction environment. So they might go to the library to take their tests away from distractions, just things like that. So a 504 plan, their purpose is to remove barriers for students with disabilities, and it bans disability discrimination. And it's covered under Section 504 of the Rehabilitation Act, which is a civil rights law. And they will often talk about free appropriate education, or FRAPE. And appropriate means just providing supports to give a child access to the same education that their peers are receiving. I think someone earlier mentioned like, oh, you know, if a person is a wheelchair, you add a ramp. If a person needs glasses, you give them glasses. Same thing here. If a person has ADHD, you might want to give them extra time on tests. Okay, who's eligible for a 504 plan? Most students with learning and thinking differences are protected by Section 504. Here are some examples. I mentioned ADHD. Sometimes kids who have an anxiety disorder, sometimes they'll create a pass for them. And if they're starting to feel really anxious, they can just take that pass. And there's a special place they can go in the school to like calm themselves down, things like that. And students who have medical conditions like type 1 diabetes, they have 504 plans, usually involving medications that the nurse can give them. Okay, so what can you do as a parent? If for some reason the school is giving you a hard time, you just want to document your child's needs. Oops, there's a typo. Find out who the school's 504 coordinator is. It might be the same person as the IEP coordinator. You want to write a formal request for a 504 plan. Now, I don't know if it's changed, but once a written request is made, the school has 10 days to respond to your request. So, I mean, if you want to call as well, leave a message, that's fine, but also write a formal request because it's illegal for them not to respond. Also follow up on your request. And then they'll take you through the 504 plan evaluation process. You'll meet with the school to determine if your child qualifies, and then you work together to create the 504 plan. There is a template I found online, and I will, once I submit the handouts of how to write a request for a 504 plan. So I'll make sure I include that. Now, as far as an individualized education program, like I mentioned, this is when your student qualifies for special education services. It's just that pull-out service, and it's developed by a team of individuals. So it involves many people, from teachers, the child, family members, designated advocates. So it's a team of people, and together you create the IEP plan. What does it include? So basically, currently, how is the child performing in school? And there's usually, sometimes they give an education evaluation and say, oh, this is how they perform, and this is why we're recommending it. All related services for which the child qualifies. So is it reading help? Is it math help? Is it communication? Does the child have problems with speech and need to meet with the speech and language pathologist? It has appropriate educational accommodations necessary for the child to be successful. Once again, it includes the present levels of the child's performance, and then they have an IEP report card where they show you progress over time. So the ones I've seen, they might say, oh, Hunter will get 30 minutes of pull-out instruction every day, or something like that. Okay, so key takeaways. Your child needs an IEP to get special education services. You do play a key role throughout the IEP process. It's very important to stay on top of your child's IEP and make sure your child is making progress. Sometimes they'll make progress and the team will want to take away the IEP. And you should not let them do that unless that requires another evaluation to make sure that they in fact are learning. Because once you take it away, they may start underperforming again. Okay, so lastly, and I got this from, what is it? The website is called Special Mom Advocate. So this mom wrote 12 things she's heard from IEP teams, and they're very similar to the things I've heard from parents. So there's some warning signs that the IEP is not being followed, or that the school is just giving you a difficult time. So the first one says your child is not eligible for special education because she is doing fine academically. So once again, you may know that your child is having problems, and you want to compare the child to themselves, not everybody else in the class. But what if your child has an IQ of 125? Yeah, it might be doing okay, but even if his reading is 90, which is average, and his IQ is 125, is still a learning disability. That's what we call 2E or twice exceptional children. If the IEP goals are written for you and you weren't consulted in the process, that's another warning sign. It's illegal for the school to tell your child that they should be on medication. A teacher should never tell your child that. Many times a school teacher might suspect ADHD, and on the rating scale, they might say, oh, Johnny has many executive functioning concerns. So it's like, I kind of know what they're getting out, but they can't tell you your kid has ADHD, or they're not supposed to. We also just talked about this. We say your child no longer needs these services, so we're stopping them. No, they can't just stop them. I've also heard, and this is from private schools, we don't have that service at our school. But even if it's not called an IEP, sometimes private schools have they'll call it something else like personal education plans. So they need to come up with something. We believe your child should be in a self-contained classroom because she is difficult to handle. Once again, the child should be in the least restrictive environment. Okay. If they say I need to take this to my supervisor to get permission to increase services, once again, that's another warning sign, and IDA has procedural safeguards set up for this. They might say we're keeping the same goal because he has not made progress and we have to keep working on it. Lack of progress is a big sign that maybe what you have for that child is not appropriate and you need to revisit and revise the IEP so that the child can start making progress on maybe on a simpler goal. Another one is this is a charter school, so we don't have the resources to serve a student with special education needs. Any school that receives government funding must provide special education services. And then lastly, we are not allowed to assess your child for an IEP unless we first try response to intervention. That's not true either. Response to intervention cannot be used to deny an evaluation if you request one from the school. We will not accept your parent concerns for IEP because we disagree with what you have written. Once again, IEP has procedural safeguards for that. Sometimes if the school is really giving you problems about the IEP, you can contact your local AEA, which is your area education service. They have something called a parent advocate. So if you've been doing all you can and you're not making any progress, go to your AEA, say you need a parent advocate to come with you to meet with the IEP team. And then finally, our cafeteria not able to provide a sensory diet. Okay, you can bring your lunch to the child, but they also can provide that for your child as well. So, okay, this is perfect. So I'm leaving 15 minutes for questions. It looks like there's 11. I'm not sure how many of those are questions in the chat, but I'm happy to take the questions now.
Dr. Joy, thank you so much. I've been taking notes throughout the presentation, so I know that there are questions that are being asked. I'm thinking about the clarity in which you shared the information about the reading, the writing, and the math, and the terminology used, because sometimes with family members, it's difficult not knowing the lingo and really what your rights are in that. So I think there for sure was one question. And so I'd like to be able to ensure that everyone that is here tonight can get their questions answered. Victoria, can you share that question with us?
Yeah, the only question that wasn't answered was, what is the other evaluation besides the IEP team saying the goal has been achieved?
What is the other evaluation?
Yes, I believe you mentioned that if it has been achieved, you shouldn't allow that to be the only factor.
Yeah, so the schools, some schools, I don't know about every school, but they conduct, if a disability is called at the top of the form, it says disability suspected. And then they do an education evaluation where they some schools do give the Wyatt and other academic tests. So they'll use the test that they have in the school, which may be sometimes different from mine. Some of them are similar. Schools can't give IQ testing, but they can give academic tests. So then based on if it's the Wyatt or the Woodcock-Johnson, which looks at reading, math, and writing, you want the student scores to show improvement. I'm not sure if all schools have those. And if not, they can come back to me and I'll do it for them. I know that school psychologists are really scarce.
So for clarity, real quick, if a student or my child, school is saying, all right, your son or daughter no longer needs special ed services, what should be presented to me at the table? So one, obviously a goal that has been achieved, maybe the ISASP or a FAST, and anything, and one of those assessments you've discussed.
Yes, so I would recommend the Wyatt or the Woodcock-Johnson for progress monitoring. I'm currently
a pre-test and a post-test of the disability.
Yes, and I'm currently working with a therapy client right now whose mom is going through this because her child was getting accommodations for writing for dysgraphia, I believe. And they're like, oh, so-and-so doesn't need this anymore. And they wanted to do something called a trial out, which is 45. Has anybody else experienced that? A TRIAL out?
We're doing that right now with our fifth grader.
And
trial out.
report at this one particular school. It might be different at other schools. They're gonna try not giving the student the accommodations for 45 days and seeing if the child remains consistent with the work that is being given. And then they will decide whether to. So it shouldn't just be yanked. The IP, like, no, you're not going to get this. I will hope that they're providing that assessment, doing a trial out, but having hard data showing that the student is making progress.
Thank you.
Is it common practice to have trial out of IEP, or is that something specific to my district?
I'm not sure if that's a common practice since I'm not in the schools. I know that every school is different, but you can ask. You can ask. I mean, well, yours has it, but. Yeah.
Another question that's in the chat is there information available in Spanish, or can you refer to some resources that may be available for maybe English is not the primary language?
Yes, and I'm gonna take a second to write that down. So the answer is yes.
And for everyone on the call, she is going to put together her slides and some additional resources that we will send out later. So we'll make sure that that gets included.
And I'm going to include a handout saying know your rights. Because as a parent, you have a lot of rights. And some schools are better than other schools. Some schools really work with the parents, and then every now and then you get a school that, unfortunately gives the parent a hard time. And at that point, you want to know what your rights are. So it is a law, so it is illegal for them not to do these things. I had one person have to get a lawyer involved, but that was a person with means, obviously, if she went that far.
Dr. Joy, you also spoke to the cultural piece that is also of significance when you are giving recommendations. Can you speak more to that?
Yeah, so for example, I'm thinking of young African-American boys who, for, I guess, reasons of implicit bias or lack of empathy, they're automatically labeled as behavior problems or behavior disorders. And I rarely, well, I don't give that diagnosis. So it's important to think of, how children from different backgrounds are perceived. I don't remember the statistics, but I recently saw statistics about how children who are, just say brown and Black children, are more likely to be suspended in schools and things like that. And a person who is not brown or Black will not be suspended for the same action, maybe given a warning. So things like that. So I think a lot of times some bias is involved, like an empathy, and some school personnel can stereotype children. And I'm aware, as a Black woman, I'm aware of these things. So I'm holding all that as I'm doing the evaluation. I'm keeping all of these things in mind. Because I guess I've been doing it long enough where children manifest anxiety, learning disabilities. It may look like a behavior disorder when it's just their way of coping, or poor coping skills with their disability. We do have the IQ test. I know it's in Spanish. They do have a Spanish version, which is nice. My friend told me that she went to Costa Rica one time and she was doing a test, and one of the questions was, how many seasons are there? Well, in America there's 4. In Costa Rica there's 2, raining and not raining. And she was like, okay, I gave her the credit, So you need to take those things into consideration.
Right. So the other thing, as you were talking about, as parents have questions about, maybe they're seeing some things, but there's still some hesitancy and asking for assessment or an evaluation. What advice can you give us regarding how to go about asking, or to kind of dispel some of the fears or the myths and asking for help, or at least someone else to take a look at it? Because sometimes there's fear, there's concern. You begin to question, did I do a good job as a parent? Am I doing a good job as a foster parent? What can you give us as advice, recommendation, support?
Right. So once again, always know your rights, and you are your child's advocate. Your 7-year-old cannot speak up for themselves. So you have to speak for them. And it's almost like keeping track of what you're seeing and what your concerns are. Is always good. And then presenting that data during conference. Go to the conference, parent-teacher conferences, and share your concerns. There might be, I've heard parents say that there's teachers who just kind of are like dismissive about their concerns. But I feel like as a parent, you know your child, and especially if the child has siblings and you're like, oh, this one is really like dragging with these skills, then I encourage you to speak up, because it is your right and you want to do what's best for your child. And then if you need to consult that parent advocate, it's free. The AEA is there for a reason to do that. So.
You talked a little bit about it as it relates to the evaluation, and then the actual 504 plan and that. So what happens if you're not satisfied with the plan? What are the other options? And I think you talked a little bit about it, but if there's any more guidance that you could give.
Request a meeting. It's your right, your right to request a meeting to follow up and say that you have concern. I have parents who do this constantly, because they don't think the school is doing their job. So they are constantly emailing the teacher, some of them even email the principal, and make sure that you're heard. And hopefully the school district will be one that actually listens. And it could be, maybe for some people might be scary, or but I don't think there's really a power differential, but because it's your child and that's your job to advocate for them. But don't worry about, if you're getting on someone's nerves, they should be responding to you. So. And
Thank
then you can, with the information I'm going to send you, show it to them and say, you know, this is my right, and you're supposed to be doing this. So.
I think we
you.
have a question from Mary Lynn.
Oh, yes. Just a second. I'm on mute. I worked for the Des Moines schools, and as a central office administrator in charge of equity and a lot of other things. And one of the things that I developed was I was the minority community liaison. So if parents felt they were being jacked around in special ed, I would go with that parent and help the parents have a voice, because everyone does not necessarily have it in them to say, you know, I know my rights. And sometimes people get really emotional about their children, and the cultural mismatch makes the school people feel like, oh, this woman's crazy. We need to call the police. And so one of the things that I find, I started as a secondary high school LD teacher, and in a school when LD was not, people said, you know, there's no such thing. And that was 48 years ago. And we're still talking about the same issues. And I just think that the AEAs ought to have someone that's culturally competent to be available for families and the children. I did it for 27 years, and when I retired, they didn't replace me. But that, you know, that is such an important thing for families.
To Mary Lynn's point, and also to a question that Dr. Chapman put in the chat, is there an alternative that you would recommend when positions like Mary Lynn was just discussing, or when diverse student staffing teams aren't available in schools? Is there alternatives that you would suggest for parents who feel like they may be needing that service? So maybe resources outside of what's in school.
I'm not sure. I can look into that and provide, when I turn in the handouts, provide some additional resources. I know some therapists who will actually sit in on the IEP team meeting if they don't have anyone from their AEA, a parent advocate, to do it. But I'm happy that, Mary Lynn, that you did do that resource, and I'll try to look for other resources. One thing I want to stress is that your child, sometimes they think that children are being obstinate, or they're being lazy, or they're just not trying hard enough. It's like, no, your child has a learning disability, and they're probably doing the best that they can. And I think it's important to meet children where they are. So say, for instance, if your child does not have an IQ of 100, say your child's IQ is 80 or 79, is on lower end, that it doesn't mean that they can't learn, but it means that learning will be more effortful for them in the classroom setting. So you should not try, for the teacher, you can't instruct them like they have an IQ of 100. You have to meet them where they are. You may have to be more concrete, you know, in your instruction. But I give the children the benefit of the doubt that they are trying the best that they can. I haven't met a child yet who has faked not being able to read. You know, that doesn't make any sense. So that's my last thing that I wanted to throw out there, and just be supportive and comforting, because they're struggling. It's hard.
Thank you. Before we wrap up here, I want to give one last opportunity for any questions.
I don't have a question. This is Dr. Chapman. I was a learning disabilities teacher, and advocating for the students that I worked with. There were students that were, like you were described, a reading disability, and I had a student like that, but he was math was his strong suit, and so I advocated for him to being gifted and talented. And so, you know, it does take a political will of educators to see that there is a difference. There are, you know, students that, you know, may have a learning concern in one area, but then in the other can be exceptional and excel.
Yes.
And I saw that happen where he was in learning disabilities for his math and creativity, but he was seeing me for his reading disability.
And it's also important that whatever accommodations the students have in a regular education classroom, when they go to ELP or TAG or gifted education, that those accommodations go with them. So if they need extra time, when they go to ELP, give them extra time there as well. So.
And it even happens in college because there is, but it's someone to advocate for that student. Once that student is enrolled in college and there is an accommodation that needs to be made, that there's someone to advocate for that student in college too, for that to happen. And I've seen that happen in college.
Yeah, at Iowa, we have a service called Student Disability Services where students can apply for accommodations. They'll say, I have dyslexia, I have ADHD, I need these accommodations. So they apply and then they continue to receive them even in college.
Yes.
They may want an updated evaluation.
Yeah.
That's fine.
So we have really reached the end of our webinar tonight, but as you can see, Dr. Joy, there is a lot that you could probably share with us for another hour. But we want to thank you for this informative presentation. Advocating for your child if a learning disability is suspected. We'll look forward to receiving not only your PowerPoint, but also those lists of resources that are available. For attendees, I'd like to say that do not forget that in April, we'll be having the last webinar in this series. And the topic is transracial foster care. And the presenter will be Brandon C. Jones, PhD and LMHC. And to let everyone know that CEUs will be available. Emily Easton is also here with us this evening. She's the Foster Care Recruitment and Retention Coordinator with 4 Oaks, the Des Moines region. We want to thank you for that partnership and collaboration for the recruitment and retention of foster parents, with intentionality of recruiting foster parents of color and supporting foster parents that are fostering children of color. To our WIN committee president, Dr. Mary Chapman, and our local NAACP Des Moines chapter president, Victoria Lundgren, thank you for your support and leadership. We hope to see everyone for our next webinar on transracial foster care. Thank you, everyone.
Thank you.
And good night.
Thank you. Thank you. Thank you, Dr. Joy.
If you did not give your name to Emily at the beginning because you logged in a few minutes late, Emily, if you would like, we can have them. I see there's a few people in the chat.
Yeah, I've been direct messaging those people that commented in the chat about that. So I'm on it.
All right, perfect.